Hi, I'm James, and in 2018, at the age of just 36, I was diagnosed with basal cell carcinoma just here under my right eye on the cheek. The skin cancer was detected when I went to see my general practitioner, my local doctor here in the UK. I had little red marks, little blood vessels appearing, and essentially I went to ask, is there anything you can do, like a skin graft, to improve how I look? Professionally, I'm an actor, so that was the main driving force that took me to the doctors to get something done because it was affecting my career. The doctor looked at it and said that skin cancer, because it was there for such a long time, I'd assumed it was a scar, and I didn't believe him. And he said he would refer me to a dermatologist as a matter of urgency. So I left thinking, well, okay, I'll go to a dermatologist in 2 weeks and I'll say it's fine. And 2 weeks later, I went to the dermatologist, and yeah, that's when the bombshell moment happened. And still, I didn't fully believe it. I wanted second opinions, third opinions. But yeah, the first 2 weeks, the really difficult part was every day when I woke up and I suddenly remembered what I'd been told. And it just, yeah, it was the same sort of boom, boom, boom every morning. And yeah, you don't want that. So because of the pandemic, it took around about 2 years to the week until I actually had my surgery. Some of that, as I alluded to before, was me looking for second opinions, third opinions, standard waiting lists at hospital to get those consultations. And then when the pandemic happened, I was actually due to have the surgery in April 2020. So just, a couple of weeks after everything locked down. So eventually it was 2 full years from diagnosis to surgery. Because I'm an actor, they allowed me to get a plastic surgeon to close the wound. So in the end, I actually had 2 surgical procedures. I had Mohs surgery on a Wednesday, and then on the Friday afterwards, I had surgery with the plastic surgeon to actually close the wound. So yeah, as you can imagine, I had 1 day in between with a giant hole on my face. So that was me again during lockdown, sitting in a hotel by myself, going through that. So yeah, the Mohs surgery was strangely like going to a dentist. It was the same anesthetic, you could taste it in your mouth. Because of the anesthetic, there was no pain. The real difficult surgery was actually closing it up because the wound was too big to actually close. So they had to cut a flap in my skin on the side and then essentially pull my face across to my nose and zip it up here. So that was, yeah, there was a lot of blood afterwards anytime I moved. So the first week was very, very difficult. Any kind of movements would cause bleeding, and obviously there was tightness the whole way around to the back of my head. So yes, those were the 2 surgeries, and now 2 years after that, I'm actually getting microneedling on the scar to try and improve it. So as you can imagine, the surgery stalled my entire career. They always say, we never know how it's going to look. Everybody heals differently. Everyone scars differently. So for literally years, well, maybe the first year, I had no idea if I was going to be able to continue with my acting career or if I would have to do something else. Gradually you can see improvements, and there's hope, and as I mentioned before, I'm now getting the microneedling, potentially might get laser surgery as well to improve the scar. But 2 years between diagnosis and surgery, and then 2 years waiting for the scar to heal. My career has just stopped for 4 years. It's affected me, as you can imagine, how that would strain a person, not being able to do what they want to do. But even just socially, having a scar on your face, the first few months, having to massage it. They say massage, but it's essentially, push into the bone as hard as you can to stop the skin tethering to the bones underneath. So that was six times a day, then 4 times a day for the first year, and that was very, very strenuous. I get PTSD just thinking about it. Initially it was every 2 hours. The one saving grace was it was during the pandemic, and obviously I wasn't working at the same time. So yeah, that was one advantage. If you're going to get skin cancer and not be able to work for such a long period of time, that was the best time to actually get it. So that's one of the positives that I can look back on.